All right, let's start out week one by going over the online orientation. I did send this to you and I did put it in your announcements. I will send everything in the announcements. It'll say week one information. I don't send a lot of announcements, okay? Only important ones. And then week one recordings is all of the information. And I will re-put in that PowerPoint for that week too, just to make sure it's in one place, okay? So let's get going.
Professor Bogart,
Yes.
just a question. The slides that you're gonna go over as far as the lecture, is that the ones that say 15, 16, 17 days, like 33 slides a piece?
Yes.
Okay, so they just separate, it ain't, okay.
I just threw them into one.
Okay.
I could put 3 PowerPoints, but I would rather it in one place.
See, it's showing up on my end like 3 PowerPoints, 3 separate ones.
Really?
There's your PowerPoints, and then there's the PowerPoints, I guess, that go along with
the within the modules they are.
Yeah.
In the modules for the overview of this week, they do have them, but they're blank. There's no pictures. I haven't touched or fine-tuned them. I've taken those and made them into something I think you'll understand better. Okay.
Okay. So I just like to follow. I ordered the book. So I have it because I'm a 3-way learner. So I just need to kind of do it. So I like to take notes along with you. So I'm just trying to figure out what's the proper ones to pick, to print so I can follow along with you.
On the announcements in Canvas every week, usually by Saturday or Sunday, it will be posted.
Okay.
So it will be before the week that you could take them and have them there for you. Okay.
Okay.
Okay, great. No, those great questions. And that's the way you learn. You got to learn, right? Everybody wants to get their good grades, and I know that. I was one of these OCD learners in my higher level degrees, and I was a 4.0 GPA all the way up through PhD. Now, nursing school, well, I was 20 years old when I went through RN, believe it or not. I graduated at 20 years old. I just got through. It didn't make me less of a nurse. It just meant that I didn't have that diligence that I do have now as an older learner. So anyway, remember the one thing I always tease the girls at work when they were going back to school, C equals RN, okay? You don't have to bust your butt for the A. I mean, A's are great. I mean, I want to do the best I can be. The point is just do the best you can do. And that's all you can expect from yourselves. And don't get upset if it's not the A that you wanted, okay? You put forth the effort, you did your best, that's the best. And that's all we can expect, okay? So please don't beat yourself up over it, because I've had students crying because they got an 88 and not a 90. I mean, an 88, I'll take it, right? But I understand, I've been there. I've also felt the same way, where a professor gave me a B on a paper. I'm like, this is not a B paper. This is an A paper. Anyway, so I get it, I understand. All right, online learning. We know online is a little different than on ground, but literally I am your teacher. I'm giving a lecture just like on ground, but you get to sit in your own environments, okay? Now, whenever you start a course, go through all the information, learn all about me. I do take and update my about the instructor every semester. I just had a brand new grandson. So I have now 4 grandsons, 5 grandsons, and a granddaughter from a grandson and granddaughter from my husband's side, and I have 4 from my side. And I just learned, my daughter's pregnant. So we're hoping for a little girl. She's been trying for a year, and she's getting married in September. So we got to look at that wedding dress again, don't we? But anyway, so I love my kids, I love my family, and I love my grandkids. So been in pediatrics for over 20 years, so I'm a happy person. I also taught adults, so I've got the dual thing for you, so I can relate them to your other classes, because I did adults also. All right, so go through that, learn every information about it. Now, if you have any concerns, as I said, text me if you're going bonkers, like I need to know now, or send me a message in Canvas and I'll get back with you. Now, you don't like what I said, or I'm not back quick enough, please contact the dean. I will not be offended. Okay, she's always the backup. I don't think the woman ever sleeps. She is up at her time, sometimes 5, 4 in the morning, answering questions from students on the East Coast. She's in Phoenix. She's 3 hours different than us right now. And you're going to call her at 8 in the morning. It's 5. She's going to pick up the phone. So she's there for you. And she really has a good, caring heart. She follows rules. Yes, she does. But she is consistent with everybody. Okay. Again, she likes to be informed before, not after. That's the important thing. We're almost the same type of person that way. So, contact me. Can't get a hold of me, you can contact her. And this is her information here. Her email is darlene.brown. It's not d.brown. There's another D Brown in the Florida system. So make sure you put Darlene. And that's her phone number. Sometimes she'll answer it right away. Sometimes she'll get back to you in between all of her meetings, but she's pretty quick. I want you to know that. So again, this is the way we get a hold of me. If you need anything, let me know. If you're not understanding something, let me know. I can stop me in the middle of class if you don't know. My goal is for you to come out of pediatric nursing, loving children and wanting to know more about them. I've had many students who never thought they'd go into pediatrics, and they've gone into pediatrics and loved it after this course. And some of you are going to go, yeah, I can't do it. And I know it's hard, but as you go through, you'll understand the way that I talk about children and even those children who's died on me. And I've had a few, okay? And I still remember all of them. And I'm still actually friends with most of the parents. I've cried with them. But you know something? I did all I could do while they were alive for the child and for the family. And that's what makes me feel good, okay? Because not everybody can be around forever. Make sure that when you are on the internet that you're wearing something appropriate. I don't want to see things hanging out, okay? You cannot be in bed. You cannot be in the car, even if you're a passenger, because as a passenger, you could make the driver distracted. So we don't want to do those sort of things. As you're talking, just be respectful. And this all caps things. I didn't know that was somebody yelling at you up till about a year ago. So don't give me all caps because I don't want to be yelled at. I didn't do anything wrong. I'm here to help you. I do usually come into class by 1/4 till the hour, or 10 till is the absolute latest I'll be there. Again, come to class on time. Your first week, you do have actually there's 2 type of discussion questions. One's all about you. I want to know about you, why you want to be a nurse. And then there is a question on the discussion board. The first one was due on Wednesday night, and then you have 2 responses by Sunday. Again, this week, I'm not crazy on Wednesday night because it's the first week. There's been a lot of movement, a lot of students. So the first week, I let you get it in by Sunday night, all of it, okay? Again, the syllabus is there. Go through it, and you can see when things are due. I've gone through the whole course. I know the on this course that I put all of the assignments in the way that they should be. Now, you're going to see that there are some things you can work ahead on. Be careful. Be very careful with that. And I'm going to go into the reason why as we keep going. Make sure you submit your homework by that Sunday at that midnight, okay? And you will have whatever your grade is. If you are over that, if you're over midnight, I mean, I don't go 3 minutes over, okay? But if I see that you are on Monday, you're putting in, or Tuesday, I have to give you a 10% deduction on that assignment. And homework is worth 20% of your grade, so be careful. Now, after that 1 week overdue, I cannot accept anything. It is a 0, and the 0 will stand. Now, when would that 0 not stand and we'd give you a chance? Well, you notified me before it was due. You're in the hospital, you had surgery, and you couldn't get to it. Life happens. I know that. Again, notify me as soon as you can. Remember, attendance is only by what's going on your Zoom, okay? But there's two ways they look at attendance, and be careful. You also have to post stuff in the Canvas course, two places. So this week you have your discussion question. You also have where you post and then you post again. And then you also have the other one, introducing yourself. So that's your 2 points of reference to come in, all right? So that's your entire attendance. As I said, 1 minute late is 15 minutes late according to the attendance rule. 1 minute is 15 minutes because we go by 15-minute increments. Now, let's say you don't come to class, you don't do anything in Canvas, something happened, you didn't notify me. If that happens for 14 days in a row, they will drop you from the course without any notification. So be careful. And this is important. There is no makeup for attendance. Now, let's say you're absent. You notify me, okay? And it's because you had to go to the ER. Submit those papers that you went to the ER on that date, and it will explain why you weren't there. Or it's looking as just missed attendance, and that could be part of that 20% that will get you dropping a letter grade, okay? So absenteeism greater than 20%, and they will, and I saw it last semester, students were notified, but they were given an opportunity. Do you have any documentation? I've had students say that their complex, their apartment or townhouse complex, all the electricity went out. They got a note from the office that said the electricity was out from here to here. It explained why they weren't there, and they got credit for that attendance because there was nothing in their power to come to class, okay? So that's basically what I said. They notify you as the attendance goes on. You know, if you miss a class, you're going to get a letter. It's going to tell you, you know, a message. It's an email, and they'll tell you you missed 5%, 10%, 15%. Just know that 20%, and you've given us no documentation, they will drop you a full letter, which means you need an 88 in this course to pass on all of your key graded assignments, right? So make sure you know what's going on. You guys have 3 courses. You have a lot of stuff that's going to be due. Every week announcement, I'll put what is due, okay? I know Canvas has it too, but refer back to the announcements because I'm very clear what you have to do, and make sure you get it in, all right? So again, anything that you have going on that, you know, stops you from getting work in, let me know. Make sure you do have an internet, or you know where to go in case you need an internet. You might have to go to the school for internet, or Starbucks. I've seen some students in, or actually one girl was in a hotel lobby, but in a side place because life happened and she didn't have internet. So just make sure you know what you need to do in case of that. It's always being prepared. Make sure that you do the assignments as listed. Always go in, check the course. As I said, I do not put a lot of announcements. So if you see one from me, please read it. There's one today that says if you need a class change, you have till 5 p.m. Mountain Time to get it into Dr. Brown, and she will switch. There's been a lot of switches this semester. She tries to work with you to make your class fit into a slot that works the best for you, and that's admirable. She has over 100 students right now that she's fit in different places, and there's paperwork that goes with all of that, and she does it for you to make sure that you have what you need. So, you know, some of you like paper. I like paper. I like it printed. You know, I have paper everywhere. And I have to go through it every, you know, quarter to make sure that I have current paper. Either printed or have some sort of itinerary of what you have to when. I mean, today we've got these phones where you can click on the dates and we can put in this due, that due. That works for you, use that. If you have to use a paper, a calendar, I've got a big calendar that I write everything on. And I cross it off as things are done. Whatever it is, please have that. Make sure you know where the course syllabus is. I do follow it, and it has all detailed how much things are worth, etc. That textbook. Now, the Calculate with Confidence book, I did send you the other worksheet, because in the Canvas shell, there is the 7th edition worksheet. It doesn't work with the 8th edition book. It is in the first announcement I sent you. Welcome to PNR204, Pediatric Nursing. And it is in there. So make sure when you do the Calculate with Confidence assignment that you do it on that worksheet. It's the end of chapter 24, questions 1 through 20. Very simple, but you can use the book, you could do it online, or you can print it, write on it, copy it, scan it, and send it back. Whichever works for you, okay? Make sure when you come to class, you know what's going on. At least look at the PowerPoint, see what's going on. You've got a great textbook, actually. It's very well written. It's simply to understand. So, go through it, see what's going on. And as we're going through the class, let me know, do you understand? And again, those areas where you're a little bit etchy, I don't know, stop me. We can explain it. We can talk about it so that you're fully understand with it. Any problems with anything on Canvas you can't get into, make sure you contact technical support. This is a help ticket. Also, remember your library, your LRC. They're there to help you also, okay? I do reviews weekly for those students who need extra help. I don't say it's mandatory, but what I say is, if you're not understanding something that's going on that week, meet with me. Now, I am not a professor that's going to keep you 2 hours trying to plunge in this information in your head. I'm going to go over it briefly, quickly, and making sure that you're understanding it, okay? But I am here to help. I want you to pass pediatric nursing and feel like you learned something. So if you need tutoring, let me know. Now, you heard me mention KGA. Well, KGA is what we call key graded assignments, which means this is the ones that you need the 78 on before we add in the homework. And that's unit exams, quizzes, and your HESI. Quizzes will be given at the beginning of class, and it will be the week before's material. So next Friday, you're going to get a quiz, 10 questions on this week's PowerPoints, okay? So make sure you go over, you study them, go back, look at the Kahoots, and you'll know what's going on. We have instituted something called CJ Sims. You only have 2 of them, but look, they're 10%. Do them to the best of your ability. Any questions with them? Your people on Canvas has taken some in-services on them, and I have too. So any questions, we can work it together. It's a learning process, and I'm here to learn it with you also. Your NCLEX questions, do them as many times as you want to get the best grade you want. Once you turn them in, that's your grade, okay? I've had students turn in and get, 22 out of 50. And they come back to me at the end of the semester. Can I turn it in another NCLEX? You can't. Once it's turned in, it's turned in. Okay, so I don't want you to fall through the cracks and not understand that. All right. One of the things we do is right now I have those assignments, homework, the grades are turned off. That extra 20% is turned off right now. So you're just going to see the key graded assignments, which will be your exam in week 4, and it'll have 2 quizzes on it. Of course, HESI's not till way later, your week 11. That's just going to show you where you are. Now, on week 6, you're going to have stuff that you've done on homeworks. I turn it on, and this basically will show you how it affects your grade. It can make it bigger or it can make it lower. It all depends on the scores you get on your homework. And remember that 20% is a lot. So if you're writing the line at like 80, 78, in your KGA, it can affect you and it can fail you. And I've seen it fail students, and it breaks my heart because I want you to do the best you can possibly do it, okay? On week 8, I turn it off again. That week 8 is your drop week, you know that. And it could give you an understanding. Are you going to drop, keep in? I will always encourage you, you know, unless unforeseen circumstances, to try to work it out. Work with me. You know, if after exam 1, you're not understanding, send me a message. We'll go over stuff together. Again, after all of the KGA is 78%, we add in the homework, it still has to be 78% after all that stuff is done. And then you get the grade for your course. Quizzes, as I said, are at the beginning of class. It's last week's information, or this week for next week. Only one attempt, you can only go forward, and there's 15 minutes, 1.5 minutes per question. If you have accommodations for longer time, I must know, you know, ASAP. I need to change things in Canvas Shell to allow you to have extra time, okay? Just send me the documentation and I will make sure it's sent to Dr. Brown, and you get it also for exams, okay? And then those who need accommodations for exams, we need to work when and where and how you're going to take your exams. That works with you for your schedule, okay? Whatever has to be done, we'll get it done. Exams are in ExamSoft, and I've seen students, all of a sudden their computers go black, or they forgot their charging cord and they're somewhere else or at their friend's house because they had internet or whatever, and it goes black immediately. Number 1, contact me. That's why you have your cell phone, right? Contact me. You can pick up that exam where you stopped off, but I have to know in order to do that, okay? Exams, 1 attempt, you can't redo them. And again, any issues, stop it, let me know. Don't worry. That exam, wherever you are, up to question 30 is already done. You don't have to redo it, okay? You will start where you left off. So don't be afraid with that. If you are that type of person that does not want to take exams on Zoom and you want to take it on campus with somebody proctoring you, I need the proctor to send me an email. You can't send me the email. That person who's proctoring must send it to me, and it should be 3 days before exams. So week 3, by Tuesday, I should know that Friday, you want to take it on campus, and it should be the same time-ish that class is. But remember, you're still responsible to come back for class. So with exams, what I say, come back at 4:20 Eastern time and have class, because I will do a PowerPoint, I'll do a Kahoot, I'll do something for that week's information. And that is your attendance, okay? We know all about ExamSoft, how to do it. You've done it plenty of times now. Your ID, show everything. You're going to see it on Zooms, and I'll ask everything that you need. Make sure you have a whiteboard, okay, for your math if you need it. Or I like either like a page, clear page cover. I put a piece of white paper in there. I can wipe it off. Or I've seen gallon baggies used, whatever, if you can't get a whiteboard. Because remember, NCLEX, you can't walk in with a calculator. You have to use the one online, or you need a whiteboard. Now, what happens if something happens right before an exam? Unexpected. You can't take it. I've had things like my husband asked me for a divorce. My cousin, they put him as a DNR last night. My grandmother died. My boyfriend's grandfather who was living with us died. I'm not going to let you take an exam. You are emotionally out of your mind. You cannot. And I'll tell you, you're not taking it. Just give yourself a couple days. You must take it within 7 days of class. So you must take it by the following Thursday. And we can arrange a time, or again, get a proctor on campus, on your campus, and have them send me, and I'll give them the access codes, okay? I had 2 different students for different reasons last semester. I said, no, you're not taking it. Goodbye. I'll see you for class if you can make it. If not, I get it. Again, always tell me before, don't tell me after. I can't tell you enough of that good stuff. Your homework, again, keep yourself organized. I mean, I have one of those big boards that I write on, whatever works for you, okay? You know, we're all different types of learners, and everybody likes something else. I'm not going to try to change you. If you need help organizing, that's something else. I can help you there. Again, late work. Let's say it's after those 7 days over to. You know you have to have notified me before, and we'll work with you according to many different situations, okay? We are understandable. We understand there's life out there besides school. But if you've not notified me, remember after that second week, 8 days and more after it's due, it will be a 0, and that 0 will stick. NCLEX questions, make sure you do what the questions are asking for. It's in the modules. It'll tell you which areas to do, very clear. And please send me the big printout. Don't send me that little green screen there. I need to see the areas that you have done. If you don't know how to do it, send me a message. I have an instruction sheet that I can send to you, or I can pop online quick and show you. Not a big deal. Again, once you submit the score, I cannot change it. That is what it is. So try to get up to the 50 as close as you can, which is your 100, okay? CJ Sims, again, complete the assignment and submit a screenshot of the completion page for your best score, okay? And make sure that this information is on there. And again, make sure that, you know, if you haven't gotten into it, you should have been sent an email and create a new password for it. If you haven't, let me know or let your campus know. They'll tell you who to contact in order to get that reset for you. And I believe that starts on week 3, if I'm not mistaken. Case studies, we only have 2 this semester, and that's the assignment exam and the practice exam, and they're both done on week 10. Again, go through the modules. It's 1 try, and we do it right before the HESI, which we feel works, okay? Any problems with it, let me know. Sometimes it doesn't go over into your grade book. Let me know. There's things I could do to check it out, or on some rare occasions, we have to get the help that's involved with it. But usually I can find your grade, okay? So don't panic. You've done it once. You don't have to do it again. We'll find it. Again, they should be automatically put over. You know, I've had many students who keep screenshots. I want you to know I can't accept them, okay? But keep them just in case, because it might be that rare case. Because if weird, wacky stuff is going to happen, it's going to happen to me, where you can't find it. It's 84 questions. You don't want to redo it again, right? Keep that screenshot just to be safe. But usually 99% of the time, I can go through and I can find it. Discussion posts, make sure you use APA. I was briefly looking at them, and what I'm seeing is there's no references. Make sure if you're answering stuff in here on week 1 that you're doing a reference, and it must be at the bottom of the discussion and in the body of the paragraphs. You know, put your book, Leifer, comma, 2023. That's showing me the information came from there or somewhere else. All different things. If you don't know how, there are a lot of references on the internet. YouTube has some great things. Purdue OWL is one of the ones that we use as I started to learn how to, APA, what does that mean? But I'm trying to prepare you in case you want to go further into your RN, BSN, because BSN is all papers. MSN is all papers, and clinicals if you want to be a practitioner. So it's paper, writing them, APA format. So try to do it right from now. And as it goes further, it'll get easier. Always follow your rubrics, instructions if they're there, and try to use newer references, okay? I do read these. I do put in, there was no references, there's no citations, and I'll put examples in the comments of these. So go back and look at the comments on them. Quizzes, as I said, they're not going to be until you're in class. They must be proctored. You must be on Zoom. You cannot do them on your own and get credit for them. So there was some students that come in late, try to put it on internet. Their Zoom wasn't working. I can't accept it. It's just, we need to be proctoring you. It has to do with accreditation and the validity of the quiz, that it was, taken, by knowledge, not by looking up something somewhere. Again, anything technical, stop. Quiz, exam, whatever. Again, notify me immediately and we'll get it reset for you. Your HESI, it'll be on Canvas, on your campus now. Most of them are not going to do ProctorU. There's been such crazy things with it, more than I can even try to explain. So they will be on campus. Your campus will be making the schedule. They do like to keep it around your class time. But remember, there are PN classes on Monday, Tuesday, and Friday. So it could be anywhere in between there. Remember, there's remediation. I will put all of these hours in an announcement right after you take your HESI to show you what it is. Your scores for your HESI will not appear in your grade book until the remediation is done. That's when you know you've done all the remediation. I have to check every single student's remediation time. Don't send me a picture. It's nothing I can do with that, okay? And reviews and questions, and these are just more that we can look at. Again, talk to me, ask me questions. I'm harmless. I don't bite. I'm here to help you, trying to help you be successful. I want, to make it as easy as I can. And if you're not understanding it, let me know. I've had students ask me, can I print out and write on the Calculate with Confidence? Absolutely. Scan it and send it back, if that's what you like. If you like to do it, on the Word document, do it that way, the one that we sent, that's fine. As long as I get the information, that's all that I care, okay? I'll work with it. All right, let's go. Any questions? So what's the one thing that you've taken away from that? Contact me before something's due. I can work with you. Contact me after, most likely I can't, okay? Unless it's something that just happened, right? But basically, I'm here to help you. I'm not the big bad, meanie bad wolf. I'm not at all. Oops. Come here. So this is the PowerPoint slide that you were asking about, Sierra. So 115 slides all together. It's a lot, okay? Some of it we go through quickly. Sometimes we take a little bit more time with. But it's really growth and development. Why is growth and development important for children? I mean, think about it. An infant born at 7 pounds. By 1 year, they've tripled their birth weight. They've gone from not being able to lift their head till they're walking. So if they're not getting nutrition, how are they feeding the fuel to their body to grow, right? So very important that we monitor this stuff. It is continuous. It goes in growth spurts. You'll see that the babies get taller, fatter, and it's all different for every single child. The one thing that we do in children that we don't do with adults, we take a height and weight every visit, whether doctor's office, urgent care, ER. And a lot of times we're measuring nutrition. There's other body systems that it can affect. It could be something like the pituitary gland and growth hormones, right? It also could be the thyroid gland and thyroid hormones. So we're monitoring so much stuff just by a height and weight. Very important stuff. Now, every child is absolutely different. And is we need to understand the differences. Now, I sent you a vital sign sheet. Now, this is the biggest one that I could think of, the differences. Look at the heart rate of that newborn infant, the neonate, from one month up to 1 month old. Your heart rate is 140 to 160 at rest. Wow, huh? An adult, 60 to 100. So when you're giving medicines or you're thinking about dehydration, fever, a 140 to 160 is normal. You're not dehydrated. You don't have a fever. Yes, you could give like digoxin, right? So understanding that will make it, you understand if you could do treatments for these children. Again, those milestones that we're looking at, there's fine motor skills, gross motor skills, and we're going to be going a lot of it. But, you know, when you are looking at getting this data collection, the height, the weight, looking, are they turning over, lifting their head up? Are they crawling? Are they, you know, taking their fingers and grabbing foods or interviewing those parents? This is an analysis of information. And we can form a nursing diagnosis from that. And it could be due to parents don't understand and they're not giving that child, that infant, what they need. And we're going to go more into a lot of it. Planning is all right. So we have a child who's not up and crawling the way they should. Well, we can teach them how to put these little toys they want right in front of them. So they have to sort of work to get there. And that's a physical therapy. And these children, the best thing about kids, they catch up so quick. And that's what I love about kids. Give them some early intervention and they're going to surpass. And that's what I love. Implementation is that they're getting what they need. We know it works because they're walking more, or they're turning over, or they're using their fingers. Whatever it is, it could be older kids, speech, they're speaking better because you have occupational therapy, speech therapy, physical therapy. So if they're doing what they're supposed to do, it worked. That's your evaluation, right? Now, there's two things that we describe as children in the way they grow. Directional patterns. Cephalocaudal, cephalic is a head, right? And caudal is your toes. So it starts with the head. And what does that mean? Well, they lift their head up first. First thing an infant does. And by 1 year old, the last thing they do, they get on their feet ready to walk. Cephalocaudal, that's your direction. Now, proximal distal. It starts out with touching things around close, and then they start reaching out to get the rattle or reaching out to get that toy or the mother's hand. It's more of that they do it voluntarily, not a reflex now. So it starts close and then they start going out and looking around for stuff. Children all grow differently, but the first year of life, the weight is one of the important ones. 6 months, it's going to double. 1 year, it's going to triple. Now, I ask you, if at 6 months, the baby was born at 7 pounds, and at 6 months, that child weighs only 10 pounds, what do you think we would have to do?
See what his diet is, and if there's an issue with them not being able to provide the nutrition for him.
Absolutely. It could be just spitting up all the time, losing calories. So we have to learn how to keep the food down. Yes, very good, Tamara. So we can catch it quick. Because remember, food feeds the brain, and the brain is getting really quick. It's gone from lifting a head to almost running by 1 year old, right? So if we're not fueling it, they're going to be behind. So understanding weight is a big thing. Height, you can have small people, tall people. That's not as much involved. It's the weight that we look at a lot. We know that everything changes as a child gets older. Their respirations go down, their heart rates will go down, they'll be urinating better. I mean, one of the things that we look at is their immunity, right? These babies are born with mom's immune system and mom's, iron from their hemoglobin hematocrit, and it wears off. So we need to know how to replace that. And that's part of the infant that we're going to be looking at. So one of the things that we should be careful of with children is don't compare two kids in the same family. Parents do that. My kid is 8 months old and doesn't do what his brother did. Seems like she's behind. And you're like, so what is your child doing? Well, they're sitting up unsupported. Well, 8 months old, that's good. So explaining and comforting, they're all different, okay? Children in good health are going to grow the way they should. Children, when they're sick, don't eat. Children with a fever don't eat. Okay. And again, missing those calories can be something that can affect their growth. So making sure that we keep them healthy is important. And we do have a separate chart for boys or girls, and the doctor's office has them, and it shows this arc. You've heard, if you have children, they're in the 96th percentile, or they're in my grandson, the 18th percentile. He's been a peanut his whole life. I mean, he's this little thing. The kid is 6.5, smarter than most 12-year-olds, and he's this little tiny little thing. So people don't understand, and they hear him start to talk, and they're like, okay. So always don't judge a child by their look, okay? So you got to understand, get to their level first. Now, the Denver Developmental Test, very important thing. You'll see questions about this thing. The Denver Developmental Screening Test is not an intelligent test. It is just assessing their developmental status. Very important concept. Are they cooing, smiling at you, imitating you? Are they moving? Are they grabbing, the rattles? Are they doing everything they're supposed to do? And if not, this is the screening test that can identify that, okay? Remember, there's a lot of things that do affect growth and development. Hereditary, the nationality and race. I mean, depending, some cultures. I mean, I live in South Florida. I live in Homestead by Miami. Okay, it's 89 degrees out there and it's hot and sunny. All right, I've got a pool in my backyard because it's that hot here. And there's a lot of Hispanic population. That Hispanic grandmother loves to feed their babies. So you will see a lot of Hispanic babies bigger, only because of their belief in their culture is part of what you see. So that's what that means. The ordinal position in the family. The first child's looked at closer, and that third child. Are you going to be closely monitoring them as you did the first? Well, usually you're too busy. So that position in the family does make a difference. Boy or girl, and then the environment. You've got environments where you've got could be violence, could be drugs, alcohol, or it could be poverty, right? Just barely making it by. You're going to see homelessness. You're going to see so many things that break your heart. With these children, the parents bringing their kids in for care, and they're living out of cars. And our job as nurses, let's see what we can get them, get social worker here. There's probably things that they don't even know about. And I always thought about that. You're looking at family and how does it function? You're going to see how they're adapting to everything that's going on. If they're able to get that child what they need, if they need this early intervention. And it actually helps the family figure out how to get things done. Sometimes you have to work with them. Again, getting patient reps in there, getting social work in there, somebody to help them figure out what interventions, what do they need, and how to get them. Most of them are worried about how much does it cost? I have no money. So we could figure out how to get that without that extra out of the pocket. So as I was just talking about homeless families, and I've seen a few. So if you don't have a home, you don't have a refrigerator, your access to fresh fruits and vegetables are going to be at a minimum because they can't afford it. So we know that they're not getting the proper nutrition. They're not getting the proper just general physical care, their sleep, all this stuff does pay a toll on these children. And again, this is something that we could try to find resources for these families. In South Florida, I have met, working in the last 10 years of my career, I worked in Nicholas Children's Emergency Room, big ER of the children in South Florida. And South Florida has a lot of, in Homestead where I live, it's a lot of fruits and vegetables and farming that goes on. So you get a lot of migrant workers here. And a lot of these migrant workers are afraid that if they come to the ER with their child because they're sick, we're going to deport them. And nurses are not involved in deportation of children. We're there to take care of children. We don't look at that sort of thing. So sometimes trying to offer them things, they're going to be afraid that we're, reporting them and they might get sent away. So it's one of those you try, but sometimes you can't. Personality is all about where they're from, their biological environmental heritage. It comes from mom and dad. Personality, it's again, each child figures up their own. No two children are the same. It's just some kids are easy, some kids aren't. Some kids, my newest grandson, I slept in a room for 1 week post baby, like baby was 3 days old when he came home. I never heard him cry at night. I never heard that baby cry. Probably one of the easiest babies I've ever heard in my life. And the kid was always happy and never cried. And there's other kids that cry all night long, all day long, and not necessarily because of anything, could be their personality. Now, your first exam has a lot to do with theorists. I did send you 2 things on theorists. One is a handout, of just a form, and the other one is a PowerPoint. The ones that you're going to see a lot on is Erickson, Kohlberg, Piaget. We will discuss also Maslow and the hierarchy of needs. Your basic needs is you need food and a house, right? Food and housing. And then the rest, it goes up to everything else that we do need. So at birth, our child, what is her goal? Well, in Erickson, what he says is they need to be able to work their environment. And if a child cries, usually a parent will go in and pick them up. They either want mommy or daddy, are hungry, or they've pooped, they have gas, something's going on. They want you to go get them. And if you don't go pick them up, they're going to be unhappy children. All right. Now, sometimes you have children that are sleepy. They're crying. They're difficult feeders. These are children that's going to take special needs. It could be moving them slower, a dimmed room, talking quietly, and being more patient with them. And sometimes that's what they need. Parents, sometimes when babies are born, they don't want to touch their infant, right? It's too little. I don't know what to do, right? Especially if they're premature. Think about it. So encourage them. I usually will give a parent the brush for their hair, especially for girls, right? Here, brush the hair. Or, oh, I see you have socks here. Put some socks on for me. Or here's some lotion. Why don't you rub your baby with some lotion? Come help me change the diaper. Very, very important. And that starts with that bonding. Now, the first reflex that an infant does is you put your finger out and the baby by reflex will grasp it and hug it. It's called a reflex palmar grasp. As they get older, it will become a voluntary one. And you wouldn't see how many mothers get that little grasp, go, oh, look, my baby's hugging me. And it's a good feeling. I'll never tell them it's a reflex. It happens because your hand was there, but it really helps with that bonding. it's hard, very hard. As you develop that trust, which is what Erickson says, that you go and you pick them up when they're asking for stuff. It's really hard. Now, my daughter had her baby. She was living at home with me at the time. The baby daddy didn't turn out to be as what she thought. And she came home to live with me. Now, I'm a pediatric nurse. I love children. I sort of know what I'm doing. I had to step back and let my daughter make her own decisions. And I still do. I'm not going to tell her what to do. So sometimes you're going to see, and some cultures, you're going to see grandma's going to try to step in and do everything and tell you how to raise your child. It's not a good thing and we shouldn't promote it. Okay. There are some things that they can give you advice on, like burping the child well, that colic thing, or maybe some things, how to put your baby to sleep easier. Some of those things are good, but don't let the grandparents just take over, or even, your sister or your aunt or whoever. Now, when we talk about the toddler, we talk about autonomy. And autonomy is, what do toddlers do? Ages 1 to 3. They tend to explore the world, right? They get on top of couches. They're trying to jump over here. They fall off. They fall on the floor. They're always, I call them the dive bomb kids. They're always doing something to hurt themselves. Now, one of the things parents do, because they're overprotective, is tell them, no, be careful, to watch out, and don't do this. And the kid's not going to try to experience new things. And you must let a child experience it. Okay. So what did I do to my grandson? He was here to age 3 before he went to his own home. Okay. I would put a big pillow on the floor. So if he fell on the pillow if he was trying to reach the hassock. I mean, it was okay, or the other chair. At least he was trying, experimenting. He's using his muscles. He's growing. He's getting aware. He's figuring things out. You got to let them do it. That's part of, cognitive. So their initiative is let go, let them do what they need. The only time that you wouldn't is if something's going to be really dangerous harm. Now, the one time Pop yelled at my grandson is my grandson learned how to swim at age 12 months old, 13 months old. And no swimmies. He could get in the water and he knew how to kick. He knew how to lift his head back. He knew how to grab sides. Very important. I got a pool in the backyard. And I told him, don't you ever get in this pool without Nana or Pop or somebody knowing. Well, one day my husband was standing there, back to him. He crawled up the ladder and came in and went across the side, and my husband saw him in the water. He picked his butt up like that, brought him in the house, went into bed, sat him down and said, don't you ever do that again. I've never seen my husband so angry in his life, because he's the most peaceful man I know, but he's never done it again. He knows he has to ask, because that's dangerous. That's the one time it's dangerous. But we know things like letting him ride a bike, let him fall down, let him skin his knee, all those things you got to let him do. Well, put pants on him, put sneakers on him, do all the things you can to help, but let the kid experiment. It's part of what they got to do. Now, Erickson goes on to say industry. Industry is what a kid does well, school age, ages 6 to 12. So don't give a kid who's 6 years old a 500-piece puzzle that's all the same colors, because you're setting him up for failure. That is going to absolutely make him feel awful. So you set him up to fail. We don't do that. Now, give him a 50-piece puzzle, larger, of an animal that you can see where it goes. That is a lot better. So industry, what do I do well? You have kids who are good at math. Some kids are good at spelling. Some kids are horrible at schoolwork, but they're the fastest runners in the whole school, or they play kickball better than anybody, right? So everybody has something they do well, and that's your industry, okay? So again, you get a kid who is in the hospital, school age, make sure that we let these kids try to do things. Again, let them try, but always give them something that you know that they can accomplish. Not that it's easy peasy, lemon squeezy, none of that stuff. You want it to be enough that it sparks it. Oh, I did that. That was hard. I got it done, so that they can accomplish. Now, adolescents. Adolescents are ages 13 up, and we do pediatrics. Actually, they say 21 at the hospital is, the oldest age. Now, adolescents, what's going on? They're all about body image. They're all about what they look like. They're all about identities as an identity. What do I want to be when I grow up? Am I going to be short hair, long hair? Do I like girls? Do I like boys? Am I too fat? Am I too skinny? Do I have pimples? I don't like my clothes. I don't like all of these things, identity. And they're trying to find their peer group to fit in. This is one of the things that actually can cause a lot of emotional distress and depression, where these children are not fitting in anywhere. And it can cause a lot of suicide in the adolescent because of identity. Who am I? What am I? What do I want to be? Nobody understands, and we've heard that, as adolescents. Adolescents, we need to let them try to do things. We need to still watch. We still needed to be parents, but you have to let them to, again, attempt them. You guide them through it, because you tell adolescent what to do and how to do it, they're going to do opposite. And that's just most adolescents there. So let these children figure out what they want to be when they grow up. Do they want to be a nurse? Do they want to be, a mechanic? Whatever, doesn't matter. Just let them get through it themselves. All right, intellectual ability. This is all cognition. This is Piaget. Piaget is all about figuring things out, is what I say. Sensory motor. Now, sensory motor is all about what things touch. And oral is about exploring the world in their mouths, okay? And then moving things around. It's the first thing that they would be able to do is they take their hand, it's moving around, and all of a sudden a finger goes in the mouth and they start sucking on it and they go, ooh, I like that. Because it has been shown through research that that pacifier, that non-nutritive sucking device, it relieves stress. Children, infants can decrease their stress just by sucking. I mean, years ago, I've seen them pacifiers good, pacifiers bad. In the 40-some years I've been a nurse, okay? But now they firmly believe that pacifiers are good. What about they found their finger? That is, they didn't know it before, so nobody put their finger there and it happened. Or getting that rattle, all of a sudden they shaked it and it made a noise like, oh, I like that. Let's do it again. Again, this is figuring out. And it goes on for each age as it goes through. So as Piaget talks about learning, remember, everything is a building block. First you experiment and you look and you see, and then you take that concept and they were able to do more and more and more with it. Now, Kohlberg is all about morality, and morality is good and bad. Now, even young kids know when they're doing something wrong. They're sort of, even those little toddlers will be looking, does mommy see I'm going to jump off the couch again? They know that, they shouldn't do it, but they're going to do it anyway, because that's toddlers. Now, as preschoolers, they're going to think twice because they know there's a punishment. And as they get to school age, they want to be pleasers. So all of these things make difference. I've said it a couple times, whatever we give a child to do, make sure it's something that they can do. And if they can't, work with them to get through it. There's nothing worse than a kid. I can't do this. I can't. Help me. Help me, please. I can't do it. And trying to help them through it. And making sure that they know how to ask for help. Even the younger kids, you'd be really surprised. Again, food is a priority. I mean, today, I know today you have to have two parents working in a household to make ends meet. And sometimes you're so busy, the easiest way to feed them is to go through a fast food, right? And they're getting high fat, high carbohydrates, and that may not be the best food for them. So we need to encourage good nutrition for these children because lack of adequate nutrition is not feeding the brain, and it can cause cognitive delays or mental retardation. Okay. It'll also have a child not doing those developmental milestones like, being able to lift their head or turn over from their bellies to their backs and backs to belly. So nutrition, 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 the most important thing for children, and especially that first year of life where they're growing so much. Now, sometimes you shouldn't be restricting fat and cholesterol, and we really don't restrict it. It's just that we shouldn't just be entirely feeding children these things high in fat and cholesterol. We know that we need it for the central nervous system, but we know that nutrition can affect. Now, years ago, we'd have surgery on children. I worked in the cardiac intensive care unit for 10 years. Before, I worked in the ER for 10 years. And one of the things that we found that sometimes kids got really sick and we had to give them TPN and, hyperal and lipids, and they weren't being fed. And we found these kids had a lot of delays because they weren't getting proper nutrition. So we found that adding onto that some tube feedings, that nutrition with the hyperal really helped. So again, looking at nutrition, very, very important. Kids that aren't fed, they're going to be angry. They're going to cry. And we're going to see it on the scale. And then children that are overfed, you're going to see them too heavy on those points of reference that we do have. And you might see them spitting up or having diarrhea. Those things can happen. That causes gas, period. So if we have these big bellies, can you imagine how uncomfortable that is for those children? Infant all the way up to adults, okay? High carbohydrates, again, you're gaining weight. And again, that gas that's going on. And then sometimes too much, it causes too much fat or protein. It just binds up the bowels and they're constipated, and constipation does hurt. Now, milk. We know the first 6 months of life, they should be getting either breast milk or they should be getting iron fortified formula, right? Now, after 6 months, we introduce foods, but whole milk should not be started till 1 year of age, okay? They need the fat in it, okay? It's important for the brain. So not low fat, no. Even if the kid is, quote, overweight, they still need the nutritional value. Maybe they need half the amount you're giving them, and maybe feed them food before we feed them their milk, but always whole milk. And they say at least till 2 years old. Children should be able to feed themselves. It doesn't matter if the spoon is upside down and it's doing it backwards in the mouth. The point is they're trying, okay? So sometimes it takes longer for these kids to eat. And many times they'll just do little things that you could pick up and eat with a cute little pincer grasp, right? Little pieces of irregularly shaped hot dogs, one of them, or chicken nuggets and macaroni and cheese is the biggest one that we know that toddlers end up liking. All of a sudden they get a sense of taste. And it seems to be the one thing I've heard all along. Macaroni and cheese and chicken nuggets is all they'll eat. I'm like, okay. We know they love finger food and they love to play with it, and like make little eyeglasses. Everything can be made into something fun and toys with it. So they're going to do it. We know that sometimes kids like a lot of sweets, but remember, this is just sugar and they're empty calories. You could do sweets by different things, giving them, just sugary candies, what sort of fruit can we give them? Or maybe a little shake of some sort. Make it fun for them. But they do need some good protein, calcium, vitamin A, ascorbic acid. These are things. And we know that as they get into that, even up to the school age, they get this, I don't like that food. That's icky. I don't want that. I want this and that. Well, sometimes you sit them and make them eat it. They're going to say, that wasn't that bad at all. As we get to an adolescent, we know that these children tend not to eat as much as they should. They're too fat. They don't have time. They grab a bottle of water and a power bar and walk out the door. It's really important that we teach adolescents how to eat properly. They do go through this growth spurt right at the beginning of adolescence, and it's like 20 to 25% of their height. So they need the food. They're growing. They need it. So they don't get the sleep they need when they're growing, because adolescents, they don't sleep. They are on their computers, they're on their phones, they're talking with their buddies in them, and they're not resting. And of course, fatigue is very common. So we know that childhood obesity has gotten a lot higher than ever. Again, it's feeding the kids what we can feed them, and those high calories and fat, and it can lead into high cholesterol, blood pressure problems, and diabetes, as they get older. So again, encouraging good food. We know that a kid who's sick is going to want to eat what they want to eat, right? I don't feel good. Can I have macaroni and cheese, please? Where you're wanting to give them broccoli and a piece of chicken. And they're like, I want to eat this. Remember, good food choices are important. Remember, sometimes children cannot express why they didn't like that orange juice to drink. And it could be something like there's some sort of lesion in the mouth or something, right? Or maybe they're getting a new tooth, or one's coming out. So make sure that we look at the whole reason why they don't want some foods. You should give a kid 1 tablespoon of food for each year. So a kid's 2 years old, if you're giving them some broccoli and you're giving them some chicken, it should be a tablespoon of each per year. And that's all they need. And I think most parents think that, especially the toddlers, that they're not eating enough. It's like they didn't hardly eat today. They don't need much at this age. They're not gaining that much weight at this age, but still encouraging good foods. Don't say that you have to just give them what they want, because then as they get older, they're only going to want what they want. So making sure that we consistently give them what they need. And they shouldn't get snacks or drinks or anything before they eat. Just like when you're feeding a newborn infant food, you feed the food first, then you give them the milk, because the food is the important thing. Always remember, if a kid, especially the younger ones, that if there are, let's say, in surgery or just had surgery, they can't eat, we still got to take care of that mouth. Because remember, this is a soothing place. Give them a pacifier. This helps them with that growth and development, sucking, self-soothing, and it will help them to keep calm. Baby's teeth we should see within the first year. We know that teeth should be coming out, and usually by age 6 is when you start with them baby teeth falling out, okay? They should get 1 tooth per month after 6 months. So if the baby's 6 months old, now they're not all the same, trust me. At 6 months, you should get your first one. So 7 months, 8 months, 9 months, 10 months, 11, 12 months. Well, at least 6 teeth should be in by the time that they're 1 year old, according to the formula. Now, a lot of children don't get any teeth. Both my kids and my grandson, no teeth. At 15 months, they got 8, all at one time. And that's okay. Because remember, all kids are different. But if a parent was to ask you, Usually this is what it is, but it doesn't mean if they're not, it doesn't mean that they're behind. All kids are different. They should be brushing their teeth. Just warm water is all they need to start with, right? To get the sugar off of them. Before bedtime is really important. And the one thing we don't think about is changing the toothbrush because of the germs, right? As an adult, I'll do it all the daylight savings things. I'll throw my toothbrush out and get a new one. But children more frequently, they tend to get a lot more illnesses. And we don't want to keep reintroducing that back into them. So change them, okay? And of course, try to keep that toothbrush only for that child. We know if you're multiple kids in the house, they're going to try to, use somebody else's. Oh, I wanted the blue toothbrush today. I didn't want the green one. So, and I wanted the yellow one. I didn't want the blue one. All this stuff, you're going to hear it, but just try. Now play. What do kids do from the moment they're born? They want to play, right? Whether cooing at you, or as they get older, they're going right to the toys, to the blocks, to the crayons, to the whatever. And they just play the trucks, the dolls, this allows for a lot of creative expression. Very, very important. Now, in hospitals, they do have playrooms. And I know that it's a pretty great one that in the hospital I worked for. Now, the only thing is these are kids that are in the hospital longer, but they don't have anything that they could send off to another kid and give them infections. They have to be non-communicable, right? Nothing that they could give anybody else. And if not, well, we can send toys to them and they could play because it is all that creative stuff that we need. Make sure that they're playing with things that they should play. As in that asthmatic kid, you don't want one of those big fluffy stuffed toys, right? Because that fluff dust could get into their lungs and now you have an asthma attack. Make sure if it's a younger kid, the toys are soft, not big hard blocks, and they can hurt themselves with, all right? So one of the things we need to be concerned about is things that can also affect the teeth. We've mentioned things like bulimia. Now, what does bulimia have to do with teeth? And this is usually your adolescence. Well, bulimia is that purging behavior where they eat, and then throw up. Well, when you throw up, what comes up and throw up? Acid from your stomach. It eats the teeth. Now, anorexia nervosa, it doesn't affect the teeth because they're not throwing up. They're just not eating. Seizure disorders have medications. Look at phenytoin, dilantin, gingival hyperplasia, right? We need to really watch those teeth. Hemophiliac, they can bleed in their gums. And in asthma, we need to be careful with them because of the medicines they're on. We have to wash their teeth after they take things like, you've heard about those inhalers that we do preventative, like in the adult world, Symbicort, Advair, Brio. In the pediatric world, it could be Pulmicort. And we need to rinse their mouths after they take these treatments to take care of them. So that's what all of those things are there. Now your little infant. So infants, what are norms? Well, we know that usually infants will eat, play a little bit and sleep, wake up, eat, play a little bit and sleep. We know that they can smile, they can coo. About 9 months old, they'll start taking a sippy cup, trying to use it. And they go through something called separation anxiety. This is when you have your baby. Let's say that you were lucky enough and your baby was home with you till you were 6 months old, and you bring him into a daycare. What does that baby do when you try to leave? Turns around and goes back and wants you, right? Or even when you go to a doctor's office, the nurse tries to take him, put him on a scale, he's going to go back and try to reach. Absolutely normal stuff that we see. Well, I would just let the mother put the kid on a scale. I mean, I make it easy on the child and myself, right? So when you see a child let's say they lifted their head, and by 7 months old, they're not rolling over on their tummy to their back or their back to their tummy. They're delayed. If you are seeing this, notify the doctor, because this is a child who's delayed. They need as early as possible. Looking at a child, we can look at the apical pulse is something we should be listening to. We do not look at radial pulses on infants. Blood pressures, 90/60 should be the first year. Do you know at birth what their blood pressure is? 60/40. Absolutely normal. Again, with that heart rate of 140 to 160. So just know by 1 year old, their breaths per minute is 40. Again, sucking is that self-soother. Children love to be held when they're fed. And remember, if they're not able to eat, give them a pacifier. It gives them that soothing, okay? And again, let them use their hands, going exploring the world. It's going to go from proximal distal. Start here and work outwards. Again, the grasp starts with that reflex, which mommy holds. And then they go by themselves, grab that rattle or your finger. And then that goes away. It's not going to be as prevalent. You're going to see this parachute. This is when they fall, they put their hands and their feet up. You can see it when you put them on over a crib, and they put their hands out like they're going to fall, and that protects them. And again, pincer grasp is thumb and finger, taking a Cheerio off a high chair and eating it. That is a perfect pincer grasp. It starts with a crude smush, and then it ends up with a fine. Always make sure that you're consistent with children. When they cry, you pick them up. They will be happier babies, and they're going to be even happier around other children. Children, when they're ready, they'll do things. You can't force them, and they actually will let you know when they're ready in their own little ways. Sensory stimulation is important. Those little mobiles over their heads, tummy time, where they're up looking at things, noises, shapes, colors, flashing lights, really important, and keep the kid on a schedule for eating. Some parents say, oh, they crying, stick another bottle in, or stick them back on the breast. If they're hungry, you'll know they're hungry. Breastfed, 2 to 3 hours is usually what they want, initially to start with. And then it could increase as they get a little bit older, but keep them on a routine. And, babies like to be hugged and loved. It just makes them feel comfortable. Again, they're all different, right? So know that every month in the first year of life, these children will change. At first, they can't lift their head. Then they're lifting their head. By 6 months old, they're rolling completely over, front to back to front. Then they're up on their knees, and then they're crawling. Then they climb up on the couch and they're creeping. And then by about 1 year old, you're going to see them try to take some steps. Very important. And it happens so quickly. Just let that child know, the parents know what to expect. Now, some infants, as I say, they're irritable, lethargic, or they shut down. What we do is we try to have these children non-stimulated, like everything quiet. Lights are dimmed. Don't have that kid, when you go outside, cover their eyes so they don't get the, sun in their eyes, okay? Or if they're by the window, shut the curtains so they don't get it. Keep everything calm and cool. They do a lot better. Most of all, these children, a lot of times we'll sit there and sing to our babies, right? Well, these ones, we should just be quiet. And that noise is what they don't like. It agitates them for some reason. Talk to them quietly. Put them in that nice snuggle, right? That swaddle, especially those young children. This is a comfort place to be. And again, go slow and easy with them. And again, that pacifier, it helps self-soothe. Colic. Ever have a kid with colic? Always crying, belly full of gas. These kids for the first 3 to 5 months, you're not going to sleep. They don't sleep, and they're full of gas. They're healthy kids, and they usually do grow out of it. Again, that lethargic child I already talked about. Infants usually, after they're fed, play, sleep, they usually can sleep up to 4 hours intervals. And hopefully, by 4 to 6 months, they're going to be sleeping through the night. Hopefully, they'll get to the same circadian rhythm as the whole family, which sleep at night, awake during the day. Unless you were like me, I worked nights forever. So my kid was always confused. Do I sleep? Am I awake? I don't know, because, I was always awake at night. So we know that infants know that if they're upset, somebody's going to soothe them. So they do rely on parents. And then keep that pacifier in the crib. They wake up at night, they can find it and put it in their mouth, okay? The one thing is, as infants, as I said, their immunization status, really important. Kids are only born with what mom has, and that wears off, and then they're stuck with nothing. So make sure that we promote vaccinations. It's against preventable diseases, getting these immunizations, and making sure that we give them when they can. There's always going to be the kid was sick, couldn't get them. There's always going to be delayed, but within reason, okay? A diaper rash can stop a baby from sleeping and you. So make sure that we put a nice emollient type of diaper rash cream on their butts and change the diaper frequently, and the baby will slope better. You want a baby to sleep. And again, we're watching height and weight, very important, and making sure they're eating well. We know by height and weight. So the first year of life, we're going to be doing hearing. By the time they leave the hospital, they do a hearing test. They're going to be looking all sorts of things. They're going to putting them on the grid, what percentile. We're going to be giving immunizations as nurses. We're going to be teaching nutrition. Parents, the physician will say, okay, 6 months your baby can eat, and you can start with fruits or vegetables, whichever you want. Well, it's going to be the nurse who really explains to the parents exactly when and how and what you'll start with. So make sure that we do really good nutritional counseling, because it allows that parents to ask questions. Always, any child, special needs, early intervention. I have seen kids with Down syndrome and autistic actually be a part of a community. It was at this pediatric special needs daycare where I did some clinicals at. And this little boy, now I said Down's autistic. This kid would walk in, sit down, he'd put his backpack in his cubby and wait for his vital signs. Now he might have to be reminded to sit a couple times, but he knew he should. And once he's done, he knew he could go play. And when it was time to eat lunch, he would go sit down. Now, because of what? He's been in early intervention since he was a baby. So early intervention does work, even on severely cognitively delayed children. So I highly recommend it. Immunizations, keep your good record, really important. It helps decrease all these serious disease. As I said, solid food, start at 6 months. At 6 months, you start to feed them. The first thing they do, you put the spoon in and the kid goes, ugh. Well, it's not that they're saying, ugh, it tastes terrible. They don't know how to use that yet. They only know how to suck on a nipple or on a bottle, right? So you have to keep doing it until they learn, oh, yeah, I do want that, okay? We don't feed them earlier than 6 months because of their GI tract. It's way too immature. And then at 4 to 6 months more, we know that sucking gets better, and then that's why they're ready for that, putting the food in their mouth and eating. So at first, let the parents know the kid's going to stick their tongue out. It's called tongue exclusion reflex, but it doesn't mean your kid doesn't like that food, because a parent might interpret it like that, right? So again, teach. And a lot of this could be the cultural ethnic practices. Now, you have some cultures that won't all be vegetarian, right? You have some cultures that don't do certain foods. Understand that as you're introducing these foods and look for different choices. If they're not going to be eating meat, you got to worry about iron, right? That could be one of the things. So maybe having more green vegetables in their diet will replace that. Or as they get older, beans can help replace the protein. So we need to be aware of these differences. So for the first 6 months, they gain 4 to 7 ounces a week. A child, when they're born and they're breastfed, the parents said, I don't know if they're getting enough. Well, if they have at least 6 wet diapers a day, whether it's stool, whether it is urine and stool, because that's still output, they're doing fine. And you will see that they're happy, comfortable, and they'll sleep after they eat because you know their bellies are full. We know breast milk's the best, but for many reasons, some parents can. The iron fortified formula is what we're going to do. And as I said, whole cow's milk is not given till after 1 year. So formula or breast milk up to 1 year. So prebiotics, probiotics, we do give these to children. Many times you'll see a kid come in, the parents are complaining of diarrhea, right? So we'll change the diet a little bit, see what they're on, but we'll give probiotics. That's the only treatment. And then making sure they're having plenty of liquids in. But we will give them food, because if you only give them liquids, what's going to come out? Liquid diarrhea, and we want to make it solid. The probiotics are going to firm it up. And that is the treatment when you go into the ER. Make sure when you're giving bottle formula, you check the expiration dates. Sometimes it's on the shelf at the store a long time. So make sure you check that. Always use clean containers that you know. Never put a bottle in a microwave. You could take a bowl of water, heat it up in the microwave, put the formula in it, and just mix it and check it, because you could burn that child's mouth. And I've seen it happen before, even in a hospital. So be very careful with that. And if there's a little bit left, throw it out. It's not worth the chance of your child getting sick. Now, if you are feeding a child and they haven't had a food, never, ever introduce it when they're sick, because how do you know if they tolerated the food or not? You just don't. So 6 months, they say, okay, you can feed your kid. The first thing we recommend is rice cereal, and you mix it with breast milk or formula. We feel it's the easiest on the body. And actually, we use rice cereal for children young, 1-2 months, that have reflux, because it thickens the formula and holds it down. It's the easiest on the body. And we should do one food at a time, 4 to 7 days in between the introduction of another. You never mix stuff in the food, okay? The only time that you put cereal in a bottle of formula is when they have that reflux. You should make them take a spoon, okay? Don't put it in a bottle and let them drink it, okay? Because then you'll know exactly how much they took. They're saying, and let me tell you, it's changing all the time. Allergic foods, orange juice, fish, nuts, strawberries, chocolate, egg whites. Now, they're changing all opinions on it, but still, these are things that do create more allergies, and we should hold off on them till they're later on in life. And the one way that you know that a kid's having an allergic reaction, they could start spitting up, they could have diarrhea, they could have abdominal pain, or they could have rashes. Those are the things that you might see. When you're going to feed these children at 6 months, give them the food first and then give them the formula, okay? And they'll eat just as much as they want. Don't try to overfeed them. Babies are small, but they need a lot of calories, okay? By 6 months old, we know that their digestive tract is ready. They're ready for some good foods. And again, low fat is not recommended. We need to give it to those children. It's as they get older, we don't need to give those extra calories for it. Breastfeeding should be encouraged, but sometimes you'll see the mother saying the baby's not full because they can't see the ounces on the bottle, right? As long as the baby's done and you feed them, don't try to re-give them more and more and more. And the one thing is, don't introduce foods before 6 months. The GI tract is really not ready to these sort of things. Babies like that moment of being held during feedings. We know that as their teeth comes in, they're going to bite the nipples and it's going to hurt. And these are all things that we can, tell them that, all right, they're starting to do these things. They're ready to eat, and make sure they get fed the food before they get the milk. Make sure that we're doing really careful to give more natural foods, making sure that you read labels on things, making sure that it's not extra salt or sugar, because those things are just empty calories. I'll say it for the third time: solid foods before milk, right? So 4 to 6 months, we start looking at that chomping, and then we know they're starting to get ready. Fruit juices, a lot of times, they'll start giving them a cup, those little sippy cups. If they can start holding a bottle, which some of them do if they're on bottles, they can start maybe a little apple juice, or a little constipated, a little prune juice, right? And those are things that we can do in order to help them. And again, orange juice should be later, and the other foods that I mentioned should be delayed also. Rice cereal, first food, small amounts. 1 teaspoon is good enough, and put it on the back of the tongue, and they'll stop that aversion and sticking it out, right? And again, offer it 4 days to 1 week in between each new food. A car seat should be backward facing in the back seat, up to 30 pounds on up to age 2. Okay, so my grandson was 25 pounds at age 2. So do I put him forward facing? So we asked the pediatrician, and he said yes, because their muscles are developed, and that's what they're looking at. So we could turn them around, okay? Protecting your baby from falling is so important. My grandson's name is Christian. The first visit to the pediatrician, he went from belly to back on the little examining table in front of the pediatrician. So that's within 2 weeks of life. So you've got to be careful to roll on the floor. I can't tell you how many parents brought their infants, newborn babies into the ER. They fell on the floor. They were on the bed. They were on the changing table. They were on the couch, and they fell. So safety, 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 safety. We have to be careful just with the falls. Always use your straps. Always have your hand on them so they don't fall. And then again, the toys, like I said, be very careful of what you give them, especially the small ones. Again, everything in their mouth, right? So here we see weight doubles by 6 months, triples by 1 year. Their head at birth is big, right? We learned that in OB. By 1 year old, the chest and head should be the same by 1.5. So if the head is still bigger, why? Something to look at. Is it hydrocephalus? Something's not right. So it's something that needs to be looked at. As I said, mommy's good stuff that she gives goes away. The maternal iron stores are really getting bottomed out by 6 months old. So remember, we need to replace that iron somehow. All right. Depth perception. Babies are born with one eye working against the other eye. They don't work together, so there's no depth perception. It's called binocularity. And then all of a sudden, about 6 months old, 9 months old, they work together. So now they can grab and they will be able to see that where it's at. Does that make sense to you? Both eyes work separate. They don't work together. And then all of a sudden they do. Again, by 4 months old, they're running. They're going from the front, their bellies turning over, a minimum of that. And then we know by 1 year, I've said it, they should be taking some steps. And then we start with reflex, like palmar grasp. We go into voluntary grasps. And then by 6 months, you'll see them biting. And this is when tooth eruption starts. And they say after 6 months, it's 1 tooth per month. All right, now toddlers, the dive bomb kids. A toddler's ages 1 to 3, and they can do stuff by themselves now. Their growth has slowed way, way, way down. Remember, I talked about Erickson's being autonomous, being able to do what they want without the parents telling them what to do. That's what autonomy versus shame and doubt means. Don't make them feel bad for trying to do something. Let them try. Protect them, but let them try. I mean, our goal is to keep them safe. And these kids are no, mine, 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 mine. They don't like to share. And it's always no. You want to do this? No. And it's just what a normal toddler is. One of the things that helps children is routine. These children love routine, ritualism. They know they wake up, they're going to eat breakfast. They know they're going to get changed. They know they're going to play. They know they're going to take a nap. They know they're going to eat lunch. They know when their bath time is. They know everything. Very important. They are comfortable. They're happy. They know what's going on. And this will help with those tantrums and those aggressions. Ever have a toddler go on vacation with you? They're hard to take care of because you do break those routines, but it's because they like that rituals. Birth weight quadruples by 2.5 years old. So born at 7 pounds, 2.5, they should be about 28 pounds, right? We know that the head and the trunk are growing slower now. We know that big baby abdomen starting to flatten out. I know all of a sudden my grandson starts with 6-pack on his belly. It's all that pudginess is going away. He's a typical boy into everything. And we know that we start to see they're being able to potty train. I mean, if they're starting to be able to hold their urine 2 hours during the day, they're ready. And we know that it's easier to bowel train them before potty training, believe it or not, the bladder. So the first thing we're going to do is try to get them to poopy on the potty, right? Or whatever your name for it's going to be. We know that they're able to maintain their temperature, their respirations are more in the upper chest versus abdominal breathing. We know that their body defenses, immune system is getting better. The digestive process, their GI tract is getting better. They're able to do more, but they're still going to be, walking with a waddle. They're still going to have some clumsiness, but it's just part of it. They're going to remember things now. Don't promise a toddler to do something and don't do it. Because I'm telling you, Christy would say to me, I promised him an ice cream or whatever. He goes, ice cream? So you can't, they'll remember everything. They are going to try different ways, this trial and error. I mean, asking the same thing over and over to get what they want, right? And again, these children are learning and building on learning to be able to create things. It's all about that. Taking a piece of information that they've learned, like shaking that rattle, they can find that rattle on different things, playing instruments. Maybe it's blowing in and out with a thing on the end going, wee, wee, or a tambourine. All of these things, all from that little shaking rattle, they're starting to do these things. They're able to be away from mom and dad a lot longer. They're starting again to know what they do is going to affect how people react. Like if they do something cute, they know people are going, oh, look how cute. And they know how to manipulate the crowd. They're really good at it. Toddlers are. I think it's quite amazing to watch some of them sometimes. They're starting to see behavior that's what they need to be, how to get what they want. They are really smart humans at this age. You think they're still babies, but they really do understand. And they're gonna, if they have older brothers and sisters, they're gonna be copying what they do. They're going to start, learning about the nose and the ears and all those things. They might mess it up at first, but they will learn them. They're going to start, flushing toilets. One of the things that we don't think about is, and it says here, you flush the toilet. They think part of themselves is being flushed away, and they're scared of it. Things that we don't think about, okay? We also need to let children know, even if they do something wrong, they're still loved, because this is a point where they feel like you don't love me anymore, if they were old enough to say that. So always say, okay, you made a mistake, but we're not going to do that again. You should have done this instead. Children, our speech gets on how they're understanding. They understand what a word is, they can use it. Right? You can't use a word just arbitrarily if you don't know what it means. So you're getting understanding. They're more and more speaking. It doesn't mean they're understandable completely yet. Of course, only mommy understands everything a toddler says, right? But they're trying to communicate with them as much as possible. And I know it's so hard. Poor little Christian trying to talk to me. I'm like, I don't understand what you want. Can you show me what you're trying to tell me? And sometimes he could. And sometimes he would just and really just want me to understand. And that's part of toddlers. Now, we do not go into autism, what it is, and don't diagnose it up to the age of about 2 years old. And that's when we might have seen little clues of it. Now, autism usually hits boys. We will diagnose them for sure at 2 months old, and we'll see different things from them. We will see them, sometimes they're not walking, sometimes they're not talking, maybe one word, really not speaking as much as they should. Number one, if they're not talking, not hearing, always rule out, is it a hearing problem? Is it some other disease, to rule out that it's autism or not, right? We can't just assume they're not speaking, oh, you're autistic. No, we don't do that. We say, okay, they're not hearing, so they can't speak. Because remember, hearing and speech go together. Again, when you're punishing a child, right? It's not punishing, it's a temper tantrum. And we give them a timeout. And it's 1 minute per year. And you need to tell them why they're being punished and when the timeout will start. When you stop crying and sit there quietly, we'll start the clock. And when the 2 minutes up, you'll be able to get back up again. And as long as you're telling them what's going on. Now, I had a daughter-in-law who must have told her kid 50 times one day, time out. Well, I'm sorry, 50 timeouts in one day, they're not going to be listening after the second or third. So pick and choose what you time out these children for, okay? And that they understood about it. And again, tell them, I still love you, but you should have done something else, right? Always be positive, always let them do as much as they can for themselves. They're really trying to be good most of the time, but we need to assist, guide them, and again, saying that I do love you, okay? Sometimes things happen and kids get scared. It could be in the dark, could be that you have a big toy in their room and they don't like it and it scares them. Try to find out what their fear is. We know dark time. We know that like flushing the toilet, body parts are being flushed away. Find out what's going on, and let these children know about it. One of the things about talking with toddlers is I'll always sit down next to them or below them. If they're on a stretcher, I would come up on a chair and sit down to them. And the first thing I'll do is open up a conversation with them. And I could say, oh, I see your t-shirt. What princess is that name? Or what superhero is that? Or wow, look at your big blue eyes. Do something, break it open, let them know what's going on, that you're listening. And then these kids, I give stickers out like crazy as children, and it really helps, okay? So once you have gotten that open, and even parents too, sitting and talking with your kids, it gives them that non-threatening. Also, it helps them feel good about themselves. Of course, you want them to try to experiment putting on clothes. Make sure there's stuff that's easy over the head, little shorts, things. And of course, I live in South Florida, so sunburn protection, very important here. Shoes should be a little bit bigger than their foot, of course. And remember, they should be decent shoes. If they've had any sort of things like hip dysplasia, make sure that they've had their feet checked by the podiatrist, because they may need a special shoe, right? Because we know we want these children to walk properly. Mom, a lot of times with potty training, it is the kid starts it all, and if you're forcing it on them, they're not going to do it as much. And you just have to wait for when they're ready. Somewhere about 18 to 24 months, you're going to see it occur. And all of a sudden, they're going to be on the potty, and you're going to have that potty right out in the middle of the living room as they're watching cartoons, like most parents do. I've seen it. But at least you're trying to get them used to the potty chair, right? As I said, bowel training first, and they're saying don't let them sit there long periods of time. Bladder training, as I said, dry for 2 hours, and use whatever words. Do you like pee-pee, potty, or poopy? Whatever your word is. You can use defecation, urination. The kid knows what you tell them what the word is, just like their private parts. Is it a penis and a vagina? What is it? That's what my grandson knows, penis and vagina. And instead of whatever the other words are for using that. So take a word, use it, let everybody know what that word is. We know they need good calories. We know milk should be not the biggest part of their nutrition, but no more than 24 ounces, which is quite a bit for a child. 1 tablespoon of solid food per year of age is good. We know little tiny pieces, because they can't chew it all. You don't want them to choke, especially hot dogs. Make sure they're nice and smushy hot dogs, right? So they don't choke on them. And they love finger foods. Picky eaters, sometimes they don't like things that are soft. Sometimes they don't like things that are hard. So these are children, they're all going to be different things. And you know that if they're not eating properly, we need to make sure that we're checking their height and their weight. Are they growing good enough? And we got to make sure that they're getting enough nutrition. In daycare, we know that it's hard for daycare. Parents have to work, so they've got to go if they don't have somebody to watch their child for them. So children, they need to know what their preferences are and any cultural things that are different, and make sure that any sort of special financial arrangements. I mean, daycare is expensive. Sometimes the state will pay for some of it, but how do you get there? How do you do that? And again, I don't know everything about everything, but I know people I can, send them to in order to get what they should, and make sure they go to a good daycare that watches them properly. Now, daycare versus preschool. In daycare, they've got very short attention spans, and they tend to play in what we call parallel play, which is they're playing with toys next to each other. They're not sharing toys, but they're playing next to each other. They're parallel to each other. And this is specific to toddlers. Remember, these toddlers need you to watch them because they like to do things that are crazy and could hurt themselves. So just be sure that we watch them. Again, telling parents to let them try and not to hold them back. Injury prevention is knowing what kids should do at what ages. A lot of times that we need to teach them and know that kids, toddlers, are very curious. They're trying to explore the world. So let them know what is safe and what is not. And injury prevention, car seats in the right way, right? Non-flammable sleepwear, using medicine bottles that the kids can't get in. Kids, young ones, toddlers will climb up on counters and get things like their vitamins and eat the whole bottle because they taste good. You know, now Tylenol could be dangerous, vitamins aren't, but you got to be careful. Make sure that the water heaters in your house are not on a very hot level, because they could turn on hot water and burn themselves. And it has happened. Smoke, carbon dioxide detectors, important. And that slat space, make sure the kid can't fit their head out in between the rails. Kids have climbed out and choked with their bodies hanging outside the crib, choked on their necks. Yes, that's why you see the slats are very short. If there's an old crib, they were wider apart. Always check the day, years for the toys and the appropriateness. Make sure they're not too small. And again, play is important. Let them play. Let them manipulate the blocks and the things. They throw them and they put them together. They'll do all sorts of crazy things with them. But again, they're exploring their world. So when they're playing with toys, many times toddlers do play alone, but they're in the same room together. They're being able to deal with another kid next to them. Remember, it's egocentric thinking. Me, mine, right? That's a toddler. And again, parallel play is next to each other. Cooperative play is when they preschoolers more, where they're playing with the same toys together, and there's something, a goal to achieve, whether it's like older kids checkers, somebody wins, right? Or they're playing in sand and they build a castle. There's a goal in the end. Again, protect the children's safety, sunburn, mosquitoes, etc., and childproofing the home, making sure things aren't there for that child to get into, right? So I didn't get into the Cahoots today. We ran into a lot of other stuff. I am going to be sending that to you so that you do have that. But in this class, you are given 10 minutes per hour, right? For a break. I went straight through today. Would you prefer to do that and get out early? Or do you want me to stop in between to take a break? It's up to you.
I'm gonna speak for me. I mean, it seemed pretty cool. This was my first time going through without a break, but I feel like we responsible enough to go use the bathroom and come right back. And if we got a question, we ask. So I'm for getting up early.
I'm vouch for getting out early.
Okay. I mean, a lot of you got to go pick up kids and all those sort of things. And I do know that. So, and usually it's right about now you'll be getting out. So, and if it's a day that I know that's later, I'll pre-warn you so that you do know. Okay.
Okay.
Well, it's been an absolute pleasure. I will send you the Cahoots. I'll send you the recording. I'll send you the PowerPoints again. Okay.
Right.
So you have everything you need. Remember, do not ever be afraid to ask me. Send a message. I usually answer within the same day. So I'm usually pretty quick. Those of you who have messaged me, so seen that. I'm usually pretty quick. So whatever you need, let me know. And my goal is everybody to pass and get through and go on to capstone, right? We need we need nurses out there. So that is my goal. Okay. Sure.
Like for like exams and stuff, like do we just